ADHD medications for kids, the types, the pros and cons, and what works best. Hi, I'm Dr. Keelan O'Connell, a board certified child, adolescent, and adult psychiatrist. Welcome to my channel. Today, we will be discussing medication treatment options for ADHD symptoms. Now, I'd like to preface with a short disclaimer on medication management and behavioral health. I've said it before and I'll say it again. In behavioral health, finding the right medication for you or your child is sometimes like throwing spaghetti at the wall and seeing what sticks. We have plenty of evidence to demonstrate that FDA regulated psychotropic medications are effective in treating mood and inattentive symptoms. But figuring out which medication works best for a given person and is best tolerated by that person is as much of an art form as it is a science. It's kind of like trying on shoes. Sometimes we have to try on a lot of different styles to find the right fit. So with that being said, let's dive into medication treatment for ADHD symptoms. ADHD medications fall into two general categories, stimulants and non-stimulants. Let's talk about stimulants first. Stimulants also fall into two main categories, methylphenidates and amphetamines. Some pros of stimulants. Stimulants work fast and they work well. After taking a dose on a given day, most people start to notice improvements in symptoms within 15 to 20 minutes. They also tend to be more effective than non-stimulants in treating ADHD symptoms. About 70 to 80% of kids have clear symptom reduction. Long-acting versions can be taken before school to provide symptom coverage throughout the school day. Some cons with stimulants. Stimulants can reduce appetite, which can lead to weight loss and concerns for stunted growth. Please see my other video discussing this concern in more detail. Other possible side effects are irritability and an increase in anxiety in some people. Although rare, some people experience increases in blood pressure when taking stimulants, and children with a family history of irregular heart rhythms may be at an increased risk of developing a heart rhythm abnormality when taking the medication. As providers, we take these concerns very seriously, which is why we obtain a thorough personal and family history before prescribing any medication. We also regularly monitor for changes in weight, height, and blood pressure, as well as heart rate at every visit. Some people also report difficulty with falling asleep if they take the medication too late in the day, or if the medication lasts for too long in their system. This can be fixed by adjusting the timing or dose of the medication, or by switching to another medication altogether. Non-stimulants are the other category of medications that are used to treat ADHD. They can include medications like atomoxetine, guanfacine, clonidine, and viloxazine. What are the pros of non-stimulants? They can be helpful when stimulants aren't tolerated, or in children with underlying tic or anxiety disorders, as these types of disorders can sometimes be worsened by stimulants. These medications can also sometimes offer up to 24-hour coverage, reducing the need for taking medications several times throughout the day. Unfortunately, non-stimulants often take several weeks to see full effects, and many people report that the effects are not quite as robust as stimulants. Some of the most common side effects include nausea, diarrhea, or constipation, as well as possible sleepiness or decreased blood pressure. Which medication is best for your child? Well, your child is unique, and so is your treatment plan. Please discuss treatment options with your child's provider. Medical guidelines generally favor starting with stimulants as first-line treatment for school-age kids. Many studies suggest that methylphenidate is often preferred in children due to its overall tolerability and lower risk for potential side effects. But there is no one-size-fits-all approach.